pretty much this, which is the one of the few in the Campus Global Fund webinar series, and specifically we were focusing on campus partners, but equally for this one, which is a very special webinar, we equally opening up to other CSO colleagues, as well as EVAC fellows, EVAC alumni, as well as other colleagues under EVAC. We have EVAC advocates as well, and all other civil society organizations. And this is critical in our space as the Campus Coalition, because mostly we have been engaging, mostly with PEPFAR, as well as our advocacy with government and other donors. And of course, one or two people within this group, they have been engaging through the regional coordinating and communication platforms with Global Fund, but mostly a majority of the advocates in here were mainly engaging with PEPFAR, right from a time when it was really difficult for us to penetrate PEPFAR, to influence PEPFAR, until at the time when PEPFAR really sits across the table with advocates to ensure that the country operational plans do happen. We feed into the process. We equally develop people's corps in other countries called community corps, and we really sign off, the corp process. So because of that advocacy, which was skewed around PEPFAR, we felt that it was important for the Campus Coalition, the EVAC fellows, the EVAC advocates, to also engage with Global Fund. We are aware that Global Fund, through the Community Rights and Gender, has been disseminating information through the various regional coordinating and communication platforms. And for Anglophone Africa, we have IANASO, but it's not everyone who had access to that information. Hence, our push and our engagement with Global Fund Secretariat for this very special webinar and a couple of more webinars to come. So this basically is the precursor around why this meeting has been convened. And for IANASO, this is not creating a parallel process, but it's just bringing additional audience. And what we have been doing as campus was equally then to share all the links that IANASO shares through its listserv to our Campus Coalition for them to join the webinars that are going through the regional coordination and communication platform. And fortunately, coincidentally, we did invite IANASO to be part of the Tanzania Campus Coalition meeting, so that equally they are part of the process and they continue then to share information going forward. So colleagues, allow me to introduce to you our presenter and guest, Lesley Odendal, who is the coordinator of the Global Fund regional platforms in the Community Engagement Strategic Initiative. Prior to this, she was the focal point for the developing country NGO delegation to the Global Fund board, where she engaged extensively in the 2 years of the Global Fund strategy, the strategy 2023 to 2024 that we are engaging in today. So let's welcome Lesley to this platform. Lesley, like I said, mostly these are Campus Coalition members, these are EVAC fellows, these are EVAC alumni, these are EVAC advocates, as well as civil society at large. So feel free to engage in us. So in terms of our structure, Lesley will present, and then after the presentation, we'll have a Q&A session. So please take down your notes and let's have more time to engage in the Q&A. This is a very important strategy for us as communities, as you will see during the presentation. I'm actually excited because it's the first time that we have more objectives speaking to the community piece. So Lesley, welcome, and take it away. Over to you.
There we go. Is that presenting well? Thank you, Donald.
Yes, it's clear from my end, and your audio is very clear. Thank you. Go ahead.
Great. Thank you so much, Donald. And thank you, Compass colleagues. It's so nice to be here. I'm from South Africa. I'm here in Cape Town. And it was nice to see many of the names that are on today's call. I actually know many of the colleagues and the countries that you work in, Malawi, Tanzania, Zimbabwe, and obviously across Africa and Southern Africa. That's where I've worked most of my life. And I used to work at Arasa, which is where I know a lot of you from. So I feel like I'm home today. Sometimes when you're presenting to other regions, you're a little bit nervous, but today I feel like I'm at home. So thank you very much, Donald, for the invitation. And interesting to hear that your experience has been more with PEPFAR and, really the Global Fund strategy, the new strategy, I think, for you in terms of Compass engaging more, in the various processes as we move towards the new funding, NFM4. I think really starting with the strategy is the key, because it highlights to us some of the kind of key areas that communities can engage in, and where we can make a difference in the funding proposals and so on. So in terms of a little bit of background, as Donald said, I'm coordinating the regional platforms. So the platform that you're most familiar with, I believe, is the EONASO platform. But just to say, there are platforms in 6 of the Global Fund regions. And essentially, so that's my current role. But in my previous role, I was also working for the board of the Global Fund, and the strategy was developed in a very, very consultative process. Some of you might have been part of that process, where over a period of 2 years, and I think something like 30 meetings, and an open, kind of partnership forum with partners from across the Global Fund partnership, an open call for submissions where we got, thousands of submissions. Most of them were actually from civil society. So I was part of that process in terms of, from the early ideas right through to what we have now, which is the final strategy. So I'm very excited to present to you. So I don't need to give you too much of a background. I think we all know where we are in terms of the 3 epidemics. And as you know, we're very off track in terms of, the Global AIDS strategy targets, the SDG 3 targets. We know that we've, in terms of the HIV and TB and malaria response, things have been affected by COVID. There's funding flatlines, et cetera, et cetera. And in terms of what the Global Fund thinks is what the partnership really thought was the best way forward is what I'm going to outline today in terms of the new strategy. So what you have in front of you right now is the final Global Fund strategy framework. This changed many, many times over, as I mentioned, it was a period of 2 years of intense negotiations. And this is what, we finally came up with. So you'll see that the primary goal is to end AIDS, TB, and malaria. And just to say, there was a lot of discussion and quite intense debate around, should the Global Fund expand its primary goal to include COVID-19 or other pandemics? And you'll recall that, we developed this really over the COVID-19 period. So this strategy was being developed around 2020, 2021, we finalized it. So we were really in the heart of that kind of work. But communities specifically actually pushed back and said, we need to focus on the 3 diseases. We're not where we need to be in the response. And given that the Global Fund is the Global Fund to fight AIDS, TB, and malaria, let's really keep the focus there. And then, as Donald was saying, really excitingly, what we managed to push through, and what the communities delegation and various communities and NGOs, civil society across the world managed to push for, was that in the center of this new strategy is working with and to serve the health needs of people and communities. And below that, you'll see the mutually reinforcing contributing objectives. And the one in the middle here is around maximizing the engagement and leadership of most affected communities to leave no one behind. So essentially that's, maximizing community leadership, community service delivery, community capacity, and all the various things that I'm going to go into more detail. The first contributory objective is around people-centered integrated systems for health. This is kind of what, if some of you have been involved in the Global Fund processes before, this is what was used to be called RSSH, Resilient and Sustainable Systems for Health. But that's really looking at how do we give integrated services, people-centered services, how do we build health systems going forward, so that it's not, building these vertical structures, etc. And then the last contributory objective is around maximizing health equity, gender equality, and human rights. And I think that's something that's very important to us, to all of us on this call. And you'll see that in the end, the work around pandemic preparedness and response, in the end, it resulted in becoming an evolving objective. So I think the idea there being looking at how can we take the work that we do on HIV, TB, and malaria and use it to prepare us for future pandemics, as opposed to it being our primary goal. So our primary goal is still the 3 diseases, and then the pandemic preparedness and response is more how do we use the work that we do on the 3 diseases to help prepare us for future pandemics. And then lastly, how this will be delivered. As you know, the Global Fund is all about the Global Fund partnership, inclusive of communities, civil society, private sector, academia, obviously implementing governments, donors, but the entire partnership needs to really understand what their roles and accountabilities are. And I do encourage you to look at the full strategy. I have some resources in this presentation that you can look at later. But essentially, for every single kind of element of the strategy, it's very clearly outlined who is accountable for what and who's going to play which role. So in terms of what is new about the strategy, I think it was very important because, as you know, the Global Fund obviously had a previous strategy, and things like gender equality and human rights were also in there, and there was also community inclusion and so on. And so we really pushed to be able to say, okay, so what's new, given that we're not doing well in the response, what are we going to do differently? And one thing that you'll see across the strategy is that there's going to be, I'm not going to go through each of these, but I'll go through the ones that I think will be of interest to you, obviously being AVAC. I know you focus a lot on prevention. So a very intensified focus on prevention across the 3 diseases. And then the second one being around integrated people-centered services. So for example, for the first time, the Global Fund in the new strategy will deliver on hepatitis services, for example. It will deliver on mental health services. It will deliver on GBV services, gender-based violence. So it's a much more integrated, people-centered response than previously, where those elements were not part of it. Obviously, very interesting or important to us is around the community system strengthening. So having a much more systematic approach to strengthening community systems, including community healthcare workers, including strengthening communities, providing resources, capacity building, and different opportunities to ensure that community priorities are included. And I think lastly, for us of great interest is obviously the stronger role and voice of communities living with and affected by the diseases. And I'm going to go into a little bit more detail around that. Like I said, I won't go through all 10 of the changes. These slides will be made available to you, but I'm just highlighting the ones that I think are of key interest to this group. So I'm sorry, these slides are super text heavy, but I did try and condense the 40-page document into 10 slides. So in terms of the primary goal, I think the key thing that's different here, or the key thing to highlight, is that there's a lot more emphasis on looking at both the biomedical approaches, but also the structural components. And so you'll see throughout the strategy, there's a lot of emphasis on, key populations, what can be done to provide, a more people-centered approach. There's around, legislative reform. So, decriminalization of key populations. We all know that that's going to be really key. But for the first time, you really see the Global Fund positioning that as, if we do want to reach our primary goal of ending HIV, TB, and malaria, we have to address these structural barriers. And similarly for tuberculosis and malaria. So I'm going to move into some of the detail. So in terms of the first reinforcing objective, you have around the integrative systems for health to deliver impact, resilience, and sustainability. And a lot of this is looking at, how can we strengthen our systems so that it can be used beyond only the 3 diseases. So it's looking at things like laboratory capacity. It's looking at things like market shaping. So, being able to, because the Global Fund orders, such a huge amount of commodities, using that to be able to push prices down or influence companies around, to give better access to markets. And yeah, just also obviously very important in this is community system strengthening as well. And then I'm going to switch to the last one because I'm going to go into more detail on the communities and community leadership, but around maximizing health equity, gender, and human rights. So you might be aware that the Global Fund is already running a number of human rights and gender programming, so that like using those learnings to scale up beyond the kind of focus countries, doing comprehensive SRHR programming. So maybe I shouldn't compare the two as an employee of the Global Fund, but the Global Fund is definitely focusing more on SRHR than they ever have in this strategy. So I think everybody's very happy about that. Youth responsive programming, and also very, very importantly, like using quantitative and qualitative data to inform our responses. I think one of the areas that the Global Fund can improve is really using our data around human rights and gender programming, so that our programming is very evidence informed, using tools like community-led monitoring and etc. And lastly, and this is something we really pushed for really, really hard, and as communities, you should push for this really hard, is leveraging the Global Fund's diplomatic voice to challenge laws, policies, and practices, that limit the impact on HIV, TB, and malaria. So, for example, in countries that criminalize key populations, or if there's countries that have practices that we know aren't evidence-based around sexual and reproductive health and rights, how can the Global Fund use its diplomatic voice, recognizing that in country or as a global institution, there are levers and personal relationships and all kinds of, just really being able to make a stand as an institution to say, it's these things hinder our response, and it's really important for us, to speak out against these things. As I said, I was going to spend more time on the objective around community engagement and leadership, because obviously, that's of key interest to us. So some of the key areas is around the evolution of CCMs. Those are country coordinating mechanisms. If you're more familiar with PEPFAR and less with the Global Fund, the CCM is essentially the coordinating body within the country, where you have civil society, government, and all the various stakeholders and representatives coming together. But the problem that we see in the CCMs, for example, is that even though we have community seats, there's obviously power dynamics. It's not always easy to make sure that your priorities get in to the funding request and so on. So how can we really ensure that communities are more involved in the entire process and are able to leverage their power at the CCM? So a lot of work on CCM and, enforcing CCM engagements and ensuring that communities are very much, heard and not tokenistic at the table. And also interestingly, for the first time in this new funding cycle, we're going to have minimum community engagement requirements that for each grant, the country will have to fill in, that they've met these minimum requirements in terms of how communities were engaged throughout the process, how many of their priorities made it through, if their priorities didn't make it through, why, etc. The second one is around really evolving our processes and guidelines and tools to support community-led organizations to be able to deliver services or also conduct oversight. So through tools like community-led monitoring, but also to really be providers of technical expertise. I think as communities, we're often engaged, but we're not seen as the experts that you are in terms of really understanding community needs and being able to, deliver programs in community. So yeah, how can we better engage communities for the technical expertise that they have? And obviously that's going to take a little bit of thinking differently. How do we strengthen the secretariat and principal recipients' capacities to be able to invest in community-led organizations? And how do we make sure that throughout the whole grant lifecycle, communities are engaged in a meaningful way and not in a tokenistic way? And of course, advocacy around UHC, universal health coverage, supporting that, making sure that, our health investments are being geared towards that. And lastly, expanding partnerships with communities outside of our usual realm of HIV, TB, and malaria communities. So, for example, since we're working with mental health for the first time, engaging with mental health communities and bringing them into our discussions and partnership in country and globally as well. So yeah, as Donald said, it's actually very exciting. It's a great opportunity for communities. It's a great time for us to really, from an advocacy point of view as well, push our priorities and say, well, this is what the new strategy says. Can we continue doing things the way we always did, or do we need to think of other mechanisms? So I know, for example, the communities delegation to the Global Fund Board, what they're pushing for is direct funding.
Michael, can you mute your mic, please? Thank you.
No worries. So I know the communities delegation is pushing, for example, for a direct funding stream to communities, because we know it's very difficult for small groups to become sub-recipients or principal recipients, so that we really support this community leadership beyond just words and a nice strategy. And I think not lastly, but as I mentioned, this evolving objective is around contributing to pandemic preparedness and response. And you may have seen that the Global Fund has been very involved in pandemic preparedness and response up until now. So since the beginning of the COVID-19 pandemic, for example, there was a new mechanism, I guess it's a new part of funding was made available in what was called the C19 response mechanism, the COVID-19 response mechanism. New funding proposals, were made, and new grants, so that communities could specifically support, because we could immediately see that the HIV, TB, and malaria programs were, rolling back, and progress was being halted because of the pandemic. And so how could we, not only our communities, but also, entire countries were given funding through this. But also, you may have seen in other spaces around the pandemic preparedness that the Global Fund has been quite involved. So, for example, with Act A, which has been, the body that's kind of been coordinating things since the beginning of the pandemic with COVAX and so on. The Global Fund has been leading on the diagnostics pillar, as well as the health system strengthening pillar. And, you may see the Global Fund in different spaces, like at the World Health Assembly, or, wherever the pandemic preparedness is being discussed, because, we do want to be seen as an entity that can support the pandemic preparedness response. And in fact, there's been a study that shows like 1/3 of Global Fund investments, during HIV, TB, and malaria responses actually did contribute to pandemic preparedness and health system strengthening. So as mentioned, it's an evolving objective. I think, as things evolve, we know there's going to be a new pandemic treaty, and, so I think that's why it was left as evolving, to see where things went. And then in terms of, partnership enablers, I mentioned that, the core principle of the Global Fund is around country ownership. And so sometimes it is difficult, when working in a country that maybe criminalizes key populations or so on. The Global Fund, always leaves it to the country to decide how they want to spend their funding and so on. But in terms of, this is now the strategy to guide those investments. This is the strategy to guide partners. And as I mentioned, if you read through the actual strategy, you will see that for each kind of element of the strategy, it's very clear who's accountable for what and who in the partnership will be doing what. And so it's very well outlined there. And of course, there'll be an M&E framework as per always, and all those important things when it comes to a strategy. So those are like the key areas of the strategy. And I just wanted to bring us back to this diagram of the framework so that you could, now that we've discussed them all, you could kind of see again where it all fits in. So the primary goal remains to end AIDS, TB, and malaria, but at the center of that is, working to serve the health and the needs of people and communities. You have the reinforcing objectives around, resilient and sustainable systems for health. And then this at the center, like super important for our work and, for your webinar series, like that is the work that we'll be looking at is, how can we maximize this community engagement throughout the entire grant cycle based on this strategy. So I'm really excited to walk that journey with you and IANASO and, and partners. And then the third being maximizing health equity. Here you see where the PPR fits in, the pandemic preparedness, and then the various partnership enablers. So that is the new strategy. And of course, then the question for all of us, and maybe that, I've tried to not speak for too long so that we can focus on discussion and sharing thoughts. The question becomes, so now what? What does this strategy mean for us as communities and civil society? Sorry, I keep saying for us as civil society and communities. That's like my home. And then now I'm working for the Global Fund. So I'm sorry if I confuse you, but we're all in the same mission, I hope. So here we go. So in terms of like what this strategy means, I think, as I said, it's a huge opportunity in terms of, at your CCM, understanding what areas like you can influence, understanding, that, well, this is now the new strategy and it says it's going to enhance community leadership and engagement in these ways at country level when we're doing our work. Is that what we're doing in country, or is there a need to, advocate, hold people to account and so on? I think also leading programs where communities and civil society are best positioned. we know also in the global AIDS strategy, there's specific targets around, community leadership, and we're wanting, more than 50% of some of our services to be delivered by communities, and we know communities are the best place to do it. So really pushing for that where it's possible. And then, of course, I'm sure, we've all been hearing and working on community-led monitoring. So really supporting that, strengthening community systems, and then also very, very important, this collaboration across sectors to address the structural barriers like the harmful laws, the policies, the practices. And then just building the partnerships. And I think my final slide, which I just included for your own interest in terms of where are we hoping CCMs, the country coordinating mechanisms, would go with this new strategy. And, obviously the governance structure in these CCMs becomes incredibly important in terms of, are communities meaningfully involved? And not only as in do they have a seat at the table, but is it a meaningful seat? Are their priorities included? All those kinds of important things. And then the second is around just supporting decision-making around the new priorities. So for example, ensuring that everybody's aware what the priorities are and what needs to happen throughout the life cycle. And again, also the new partnerships. So for example, pandemic preparedness, or even, the new areas of work. If in country, your grant is going to include, a big gender-based violence component, are you bringing in those partners? If you're going to do mental health, are you bringing in those partners? And so on. And also, I think very importantly, what we see in a lot of our CCMs is that in some cases, there's not a lot of renewal of members, or just reflection on, do our current members, are they the best group of people that we need to be able to take this agenda forward? So just looking to see if there's any adjustments. And maybe the last thing I'll say is at the bottom of these last two slides, we've put all the resources, and Donald and the team will make these slides available to you, but you've got the full strategy. It's available in a range of languages, and there's an executive summary. So if you're interested in just a 2 to 3 pager to get the really key highlights, do have a look at that. And then there's also the strategy framework, which is basically the key kind of what I focused most of the discussion on today. And I think I will stop there and allow us to have a discussion. Thank you.
Thank you so much, Lesley, for a very comprehensive presentation of the Global Fund strategy, and well summarized. I try to go through the 40 pages, but then the way you summarized it is very clear, very succinct, and it really makes sense to us. So colleagues, I don't want to summarize anything. I don't want to take or add anything. This is our opportunity to engage with the strategy. The very, good questions that Lesley also asked. What does the new strategy mean for community and civil society? So that's the biggest question that we have, and equally, quite a number of us also sit in the CCMs. What does the new strategy mean for the CCMs? So can we chime in? Can we ask questions, points for clarity, inputs? This is our time to engage.
Thanks so much, Donald. Maybe I can also add a few things in terms of what next, for communities or this group in terms of, for the strategy. So as you might be aware, we're moving into what's called NFM4. Then it's called the new funding model, but it's not. But essentially, it's the next cycle of grants, and the countries are divided up into windows. And I think a lot of the countries that you work in are either in window 1 or window 2. So that's coming up quite soon, those application rounds. So window 1 is in March already. And oh, I'm seeing a great question. And yeah, so in terms of next steps, some of those materials have been made available, the new funding materials. In fact, I'm going to, before you send the presentation, Donald, I'm going to add information about the new funding model for you to send to the group. But all the new funding model materials are available. And there's, starting towards the end of September, there's going to be a range of webinars on, you know, how to apply, different areas and so on. And then also the various regional platforms are also holding regional meetings, webinars, you know, taking this documentation, translating it into, you know, more community friendly language, so that, you know, you can also share it across, and just really highlighting what are the different steps in which you can engage. And as you may or may not know, but I can also include this material, the regional platforms give out short-term technical assistance grants. And, you know, now for NFM4, this is really for us crunch time. We really want communities to be engaged in the process. And so if there are areas that you may need technical assistance, like convening to identify community priorities in your country to take forward, or support to participate in the country dialogue, or if, you know, it can be things like you know, if you don't have enough information on various key populations in your country, like if there's not a good size estimate of the number of sex workers in your country, then that's something that your community can also work, because then you're coming to the funding proposal with, you know, good data that maybe the rest of the country doesn't have. But perhaps as a follow-up to this call, we could also do a webinar specifically on the various technical assistance opportunities, because it's very useful in terms of strengthening your engagement in this funding cycle. So really taking from the strategy to now, okay, we're going into a new funding cycle. What are those various steps at which communities can engage, where we will take the principles from the strategy and keep reinforcing them. I'll stop. I see a good question in the chat. Maybe I can start with that.
Yes, Lesley, go ahead.
Great. So John says, as we know, the strategy will depend on a fully funded global fund. The global fund is embarking on its 7th replenishment next month. What can Compass and AVAC partners do to support the replenishment? I don't know how well placed I am to answer this question, but what I want to say about the replenishment is that you're 100% right, John, that the success of this strategy is very much going to depend on what is raised at the replenishment. And in fact, depending on how, like for these different strategic initiatives, for example, so like our strategic initiative, we have a number of strategic initiatives at the Global Fund around human rights, around gender, around many things, but those are some of the key ones that are of importance to us. And in fact, for each of those amounts, we actually have different scenarios depending on how much we raise at the replenishment. So we're aiming for 18 billion, but for example, if we only get 16 billion, then each of those strategic initiatives get a cut. And of course, what countries get will also get a cut. But you see, like, it's as you say, John, it's actually a very important aspect for us. And I'm not sure, you know, what Compass and AVAC has been doing to support the replenishment. I think the best thing to do is to connect with GFAN Africa and see and they have focal points in all the African countries. So you could connect with them and see what actions they're taking in their countries. I know, you know, many groups have been writing to their various ambassadors to ensure there's also obviously domestic resource mobilization in your own country. That's very important, but I don't know if anyone wants to add. Yeah. Hi, Veronica.
Hey, Leslie.
I'm smiling.
I-
I owe Veronica an email, so I'm smiling. I see her hand up.
It's okay. Hi, everyone. I have a question regarding to seventh replenishment. For Tanzanian case, the seventh replenishment will start in September, and I would wish to know the kind of the support we can get so as we can track those funds, because we know that the seventh replenishment will start in September, but again, they will open the doors for CSOs and community at large to start applying for funds in starting from January to March. So I would wish to, if it will be okay, to support countries which they need the support on tracking the fund and support for the for this activity which is going on in each country. That is my my take, my question. Thanks.
Should I take that one?
Lesley, we
first?
we
Yeah.
can take Munya, and then maybe you can respond to both.
Thank you, Lesley, and thank you, Lesley. So in Zimbabwe, we have a unique setup where resources come from the PR, who is UNDP, goes to National AIDS Council, then goes to UNFPA, and then finally goes to implementing organizations. And I feel that in the spirit of effective program implementation, we run the risk of affecting the way programs are implemented because of the route through which resources are going, which leaves a lot of our partners that we are working with lagging behind in terms of their implementation timelines. So the question is, are we likely to see a change? We understand the unique setup in Zimbabwe where we have to work with UNDP, but between UNDP and the implementing partners, are we likely to see a new dimension, particularly in the way funds flow from the PR in the new strategy? Thank you.
Thanks, Munya. Maybe I can start with Munya's question. So I think, Munya, the setup, I know it's unique in Zimbabwe, but it's actually not that unique to Zimbabwe. We also work in a lot of challenging operating environments, where there's the safeguarding policy, etc. So I won't go into too much details, but the situation that you're outlining now, where the funding goes to a UN agency, then goes to an AIDS council, then goes to another UN agency, and then goes to an SR, and then maybe to an SSR. Like, that's exactly, I think, the situation that this new like strategy is trying to push back on. I think that's exactly it, is that how do we get more civil society and community PRs, for example, so that the money isn't doing this like long loop just to get to communities. And as I was saying earlier, like the communities delegation, for example, is really, really pushing for direct funding for us to find a mechanism that direct funding can go to small community groups, as opposed to like the long route that you've explained, exactly because of the various principles outlined in the strategy, which says there must be community leadership, which says, and I encourage you to read that section around community leadership, because it talks about the different things that they, changing our guidelines, looking at our financial control criteria and so on, because that's exactly the kind of thing we want to be avoiding, and getting the funding more directly to communities. In terms of your question, Veronica, I think, yeah, for the replenishment, as you know, it's next month. And so there, I think the best route is to connect with GFAN Africa. I know they have country focal points and they have a lot of activities happening in country. So you could plug yourself in with those different country focal points and the activities that they're doing. But Veronica, in terms of, and I'm so happy to see you here, by the way, in terms of like the funding in country and so on, that's exactly what I was talking about, is that, you know, so the regional platforms are going to be making a lot of this information available in more like community friendly language. And we're also going to be doing a series of webinar with the platform, but also supporting Donald and the team to, oh no, we've lost Veronica, but I will let her know as well. But yeah, with Veronica, with you know, with the Compass team, we're also working on a series of webinars so that it's clear exactly where you can engage. Thank you.
Thank you, Lesley. I see Chiera, but before I take Chiera, there are a couple of you know, additions from Amanda. I see one for how to engage on the replenishment. See the resource section to join the CSOs-led advocacy on the replenishment and join the voices. So there's a link there. Thank you, Amanda, for that. And Bumisai Bonzo from Transmart is saying, thanks, Munya, for asking and raising that up. It's affecting the implication of our programs and reversing all the gains. And this is in relation to the multi-layers in terms of the resource disbursement or the resource structure or the implementation arrangement. And then Amanda also says, see the CSO toolkit with templates and resource materials by CSOs for CSOs to support the replenishment. So that's again around replenishment. And then Francis is the campus coordinator for Tanzania, is saying effective engagement of community-led organizations into Global Fund implementations. What can be done to have SSRs in the country structure so as to create a room for more CSOs? As in Tanzania, for example, we only have PRs and SRs. Of course, David is apologizing during another meeting. And Francis is equally saying, and also, does Global Fund limit the PRs on the number of SRs to sub-grant in their country, in their countries? So 2 questions from Francis. I will take Happy, and I also, okay, we've just dropped the other hand. Happy, please go ahead. Then Lesley can take the 3.
Thank you so much. Thank you so much. I highly appreciate Donald. Hello, team. Hello, Lesia. My question comes like upon the SRs and PRs upon Tanzania. It's like, yes, they include, let's say, on the side of THPS, they did select some CSOs, but the issue comes, especially on people who use and inject drugs, but it's not all the CSOs of people who use and inject drugs are taken, but few example for Tanpud, but there was like an issue. And the issue is they did select themselves to like the area where we should work. But that area, to be honest, there's no people who use and inject drugs. And then when we try to inform them, they've ignored it. So there is a contract within Tanpud, but that doesn't exist. I'm saying it doesn't exist because when we updated them, they couldn't listen. So it's like really a question mark. And also, when we tried to ask, there was a point of time we were with Vero too. I think she can talk later on that. She did call a certain meeting, and I did ask Ambref, why do they plan things without engaging the community themselves? But they were kind of, oh, you know, it's TF who do the selection where we should work. So I really want to know on that area, is that true or not? And how can we advocate for that? Should we write to the CRG or no? Thank you.
Yeah. Yeah. There's another hand.
You can go ahead. Oh, Queen B is back. Shira, please go ahead. Then we can then take those 4. Go ahead, Shira. Can you unmute yourself and ask your question? Lesley, I think let's take these ones. I think is a challenge with Shira's network. Please go ahead and respond to this.
Very much, Mr. Donald. Just want to have a clarity if there's a process and when it's like the process of the SR to Zimbabwe, there's a problem of like for us who are implement like the COVID needed when we need it makes was
we can hardly
get that is received.
Chira, we can hardly you. Can you type your question? Looks like your network is not that good. Please kindly type your question while Lesley responds to the 3 questions. Thank you.
Okay. So colleagues, I'm going to do my best here. I think in every single, like when I was on the board delegation, working for developing country NGO delegation, we would hear these kinds of issues that you're raising now about the role of the SR or, how many SRs are we allowed? Why don't we have sub recipients? Why do they choose a certain PR? All those kinds of questions are something that happens all over the Global Fund's portfolios. And this is where this balance between country ownership and, the Global Fund being able to influence things comes in, because those are decisions made at the CCM. And so that's when it becomes, really important for us to understand how the CCM works, how we can influence the CCM. But what I want to kind of say that about this broadly is that this strategy is exactly trying to address some of these issues. Like if you read it carefully around the community engagement and leadership, you should be able to see that communities really pushed hard. Like it was people like the communities delegation and the civil societies delegations who pushed really hard and said, we cannot continue this system where, we have UN PRs or where we have big INGOs as PRs and, the small CBOs who know the kind of information that Happy, hi Happy, nice to see you, the kind of information that Happy was saying, like Happy knows where people use drugs. She took me there in Tanzania. I saw it with my own eyes. And so why aren't we talking to people like Happy? Instead, people, NGOs working in the city, sitting in their office, they're the ones making decisions. And it's not always what makes the most programmatic sense, right? We all know this. And so if you read this strategy, exactly the point is how can we transfer the power and the funds to communities and to civil society? How can we, and that's why I'm saying it's a really good advocacy tool for us, because the question now is what needs to change for us to be able to do that? As you all mentioned, sometimes there's big financial controls that, small groups or community groups just will never be able to reach those things. So how do we move from making that the community's problem to making it the Global Fund's problem? What does the Global Fund need to do differently? Do we need to find a way to channel the money that it goes to, maybe a regional participatory grant maker, and then that grant maker, gives small amounts of money to various small community groups? Because right now the burden is kind of on community groups to prove that they can do X, Y, and Z as opposed to just and like those were some of the things I was highlighting. How do we how do we make use of the real technical expertise that communities have? So I'm not giving you a good answer, because the problems that you are highlighting are problems that I'm very aware of. And as the Global Fund Partnership, we try to influence this strategy as much as possible so that we could say to the Global Fund, like, look, you said communities are at the center now. So how does that really translate in terms of our PR structure, in terms of our SR structure, in terms of like working at the CCM, you know? So my hope, and we're all going to have to work together in the next coming months and years, is that using this strategy as like an advocacy tool, so that when we go back to the CCM next year, and if you see at the CCM next year that everything is exactly the same, you can say, no, it's not supposed to be like that. This new strategy says we're supposed to be empowering small groups to become SRs. We're supposed to be removing these financial barriers, all these kinds of things. And that's also why, you know, we're also trying to make sure that we can evolve the CCMs so that the governance is more inclusive. It's why we're trying to do things like a minimum expectations. So like in every single country grant, they will have to sign a document to say we did all these minimum requirement steps to engage communities. So that's my like very long, broad answer to you. I'm not going to be able to sort out each, you know, small PR SR issue, but in terms of like a way forward, I would say that's my kind of my recommendation. And what were some of the other questions? Oh, the conflict of interest on CLM. I mean, there are supposed to be policies around that. And I think that's, if you suspect something like that, you should, you know, be in contact with your country, your fund portfolio manager, and, you know, escalate the situation and take it from there. But I agree with you. It's the CBOs who do the work on the ground that should be leading. You know best what communities need. And so hopefully when you read the strategy, you can see that, you know, we really try to push for that. But now the question is, how do we operationalize this strategy? And so all these things around, you know, evolving how CCMs work, changing our policies, you know, like supporting communities more to be involved, that will need to happen. I'll stop there.
Thank you so much, Lesley, for the responses. And I see that we are over our timelines. We had committed an hour, but I see a couple of questions. Maybe with your indulgence, we could just look at the questions in the chat box. Can I ask Winifred to go ahead and ask your question verbally, because I'm trying to read it, but maybe failing to interpret what you're saying. Winifred, please come through and share your question. Whilst you're doing that, there is a question that's coming through. The other questions, I think you included them in your response. The follow-up question to Happy, and good to see you, Happy, from Yasmin. You did respond to that. And the GFAN one, equally you responded to that. There's the issue around the leadership strategy. So let's dig deeper into that content and get to prepare ourselves in terms of advocacy. I saw a question around the application window from Wezi from Manaso. How do CSOs effectively prepare to engage in funding requests for the first submission, as the case of Malawi? So that's one question from Wezi. So maybe before Lesley comes through, I think Malawi is fortunate that I'm just coming through from Malawi. I was in Malawi with the campus team, and equally one of the advocacy, and you know campus focuses mostly on advocacy. One of the advocacy interventions or campaigns that we're focusing on is to ensure that there's more involvement of civil society, there's more utilization of TA through the CRIG. So I'm happy that Lesley indicated that We might have a webinar on TA, that's very important. So we need, and equally for CSOs, we need to start to prepare early enough so that we are well prepared. We cannot wait for the letter that will come, the allocation letter that will come through in December for us to start preparing. It's about us preparing early. We now have the ammunition in form of the this new strategy. So let's start to engage. So our campus has started to create platforms for that engagement, but working with the traditional organizations that have been leading these dialogues, but equally applying for more TA so that at least there is more support to countries. Similar intervention will be in Tanzania next week and another intervention in Zimbabwe. So for the 3 campus countries, there's this support that's coming through from an advocacy perspective, but equally from a support to ensure that we continuously engage. And now that CRIG will also be disseminating more information through these webinars, we are equally going to be equipped even more, and we'll equally be riding on the IANASO webinars to ensure that we have all the ammunition in the NFM4 preparations. So maybe over to you, Lesley, as we round up our conversation. I know people are eager and people are excited. I see more questions in the chat box. So maybe over to you in responding to Wezi, but also you can respond to the question by Francis. And if we don't have any other questions, we then can close at 10 past. Over to you, Lesley.
Thanks so much. Well, I think the Wezi's question you answered very well, Donald, in terms of, you know, so as I mentioned, I will add to the team, I will send the information on the new funding materials that have become available. And then there will also be a set of webinars starting from the end of September. I think the first one is 22nd of September. So I'll send the links and you can register there. And then also, you know, follow what IANASO is doing. They'll also be doing a set of webinars around this. And yeah, just keep working with your country partners and make sure you're involved. And as Donald said, there are also TA opportunities which we can discuss further, or you can directly reach out to IANASO and they can give you all the information. Francis' question is, when there's a gap in this I can never say this word, operationalization of the global fund strategy. Well, firstly, just to say that the new strategy starts 2023. So right now, it's not, you know, if they do something that you see that's out of the strategy, you can say like, well, the new strategy says we should be doing this, but officially it only starts next year. But we really need to start preparing ourselves. As Donald says, don't wait till the letter and so on. But my advice, if at a country level you feel like you're not being heard as communities, I always advocate reaching out to the delegations. So your countries would be represented by the developing country NGO delegation, as well as the communities delegation. And they can play a really nice brokering role in terms of taking, you know, first you having a call with them where they understand your issue and can maybe guide you further if needed, but they also, you know, have the ability to escalate it to the right people within the Global Fund. So, you know, to the funding portfolio manager, or, you know, whatever the case might be, or whoever's supervising your CCM in the CCM hub. And it just helps because it's not you directly, you know, now reaching out to your FPM and they don't know who you are and all those kinds of dynamics. It's like you're entering the room with those delegations already behind you, and they understand your issue and, you know, they take it forward. And we have many examples, you know, like right now, anyway, I won't mention countries that we're having issues in, but in my history as a delegation, we've done that a lot where, you know, when issues arise, working with communities and civil society to help them connect with the right people in the Global Fund and broker a solution, and if needed, bring in the right CCM people and so on. So I'll stop there.
Thank you so much, Lesley, and colleagues help me to appreciate Lesley for this time. Lesley is very busy. You know, Global Fund teams and secretariat are always busy. I want to thank you again, Lesley, on behalf of EVAC Campus, civil society in Malawi, Zimbabwe, Tanzania, and across the globe. I want to appreciate you finding time to be with us. Friday is not an easy time, but at the same time, I want to appreciate all colleagues for joining. We had most about 49 participants, which is good, especially on a Friday. And equally, I want to assure you that as part of the webinars that we are looking forward to, we were engaging with the communities as well as the developing country delegations so that they can come through and also share what they do and share their links so that we continue to share that information. We did share, Lesley, we actually did share with the campus coordinators and campus partners the links for all the September to December webinars from Global Fund. Yes, so we continue to equally share the ones that IANASO is working on, and we equally have shared the replenishment webinar that's coming through next week. So we continue to disseminate that information, and please, colleagues on the call, continue to share with other people as you receive these webinar information and webinar link. Again, I want to appreciate all of you, and enjoy the rest of your day, enjoy the rest of your evening. Goodbye, and have a good weekend. Thanks again, colleagues, and bye-bye.
Thank you so much, everyone.
Thank you. Thank you so much.